Okay, we're recording this on November 2nd, so we just had Halloween.
The Upper East Side is like Halloween town, and they shut down these streets.
Oh,
And
I saw them doing Thriller.
oh yeah, I went to that parade one time, but it's so crowded. Like,
Yeah.
yeah, that was a crazy parade. But no, like we're at my neighborhood, like they blocked off some streets and there was like a DJ in the
wow.
street, and all the brownstones are decorated and all the kids are running around just in swarms. I felt like I was living in a real Halloween town. So it was a very wholesome Friday night, and it was fun.
Honestly, I hate Halloween. I know.
Why?
Everyone, I hate it.
You
I
said
hate it.
I know
hate it.
before
I hate it.
anyone said it.
I know.
Yeah,
Like
she
I'm
knows.
literally walking around our neighborhood today and I'm like, I cannot wait for everyone to put their junky Halloween decor away. I hate it so much.
Yeah, you're the Scrooge
Yeah.
of Halloween.
Yeah,
I
gosh.
am. I'm just like, oh. And so I never really get into it. But the one silver lining of Halloween is that it's where I met Ethan, my husband. It was a soccer tournament. We were both playing club soccer at Clemson, and we were paired up. Like, we didn't know each other. We got paired randomly for this like costume party because there was a tournament over Halloween.
Yeah.
And so we met up wearing like the same outfits, and it was so cute. And then we talked all night. I was like already in love with him. That's the one thing I do love about Halloween is it reminds me about when I met him and I was a little smitten kitten. But otherwise,
Yeah.
I really hate it. The only good thing now is now I can dress up Palmer and she can be really cute.
What'd you dress her as?
She was a bumblebee.
Oh,
She was adorable. I know.
Oh, so fun.
And Eden had something very spooky happen on Halloween night,
Spooky.
which involves
Yeah,
a lot
guys.
of blood.
If you ever have a nosebleed that lasts 2 hours, that's not normal. Don't let it happen. My nose started bleeding, guys, and it bled for 2 hours. So
Scary. Like
yeah,
scary.
super scary. And then
Gory.
it was a problem for the past, like the whole weekend. Like this morning is the first time I'm waking up with new energy and new life. I feel like a human again because both nostrils were fully clotted with blood going
Oh my
to bed.
How did you even, were you like
I literally was like,
sleeping?
and I had towels like all around me in case I started bleeding everywhere.
Wow.
Yeah, it was really bad.
Did you have dreams about bleeding?
Probably. Oh, you
my
know
God.
what? We just started watching Stranger Things. Sorry, my husband has watched it. He's finally convinced me to watch it. And it was truly like, if y'all have seen Stranger Things, there's this little like thing that comes and gets people. That's what was coming out of my nose. Like it was Stranger Things. And
Ew,
I
I
was-
know.
Oh my
I was
gosh.
like, blood and stuff doesn't bother me, but I was like talking myself through it, like dealing with the blood. I was like, you're good, you're good. I was like making sure my knees weren't locked. It's like really not doing
Yeah,
well.
it sounds like it was not a comfortable situation. Like,
Yeah.
honestly, you probably should have gone to the emergency room.
Yes, I should have.
And
But here
instead,
now.
she went to a Halloween party.
Yes, I
And
had
wore
to
a
go.
mask.
Yeah, I went in like a really ugly. It was like glasses and a nose and a mustache all connected. It was like a huge nose, which worked out really well because it covered my bloody nose. But I think it was making things worse because it was a little bit too tight. And I'm like, do I feel more embarrassed by this mask or my blood like dripping down my face? And then someone said they were like, it's giving 11 from Stranger Things. And I was like, I should have just not said anything, like made it like
Blood
act like it was
everywhere.
my costume. But then I was concerned, like, is this, like, could this spread diseases? Is it bad to walk around with
my
like
gosh.
real blood coming out of you? I don't know.
I was saying you should have been Amanda Bynes from She's the Man and just put a tampon up your nostril, carry
See,
around
and
a
I have-
soccer ball, and just proceed as normal.
I have done that. I really have.
You put a tampon up there?
Yeah, because I would get nosebleeds before soccer games. And so, like, on the bus, I would just, like, have a tampon in my mouth.
Oh my
Maybe I do
gosh,
have a problem.
Eden. I know. I think, once again, why don't you go see your primary care, get some labs, and then we'll
Okay.
go from there. Yeah.
Oh.
And we're going to have Kathy on, Melayna,
True.
to talk about nosebleeds.
Bless. You're going to
I
need
know.
that, Eden.
Yeah. We got to
Free
learn.
care for
You will
me.
benefit.
Yeah. Melayna, any funny, embarrassing stories or like your favorite costume from Halloween? Keep us in the spirit.
I love seeing all the kids in their costumes in the neighborhood, and as you're walking around just being like, yo, I love your costume, and seeing their reactions. One kid was the subway that I take to work. Like, he created a big cardboard box, and it was the 5 train. So I
That's
was
cute.
like, I love your costume. And he was like, yeah, it's the 5 train. He's like, what do you take to get to work? And I was like, I take the 5 train. He's like,
Aw,
really? And he was like,
that's cute.
uptown to the Bronx. I was like, yes, uptown to the Bronx. So just like the excitement of this like 8-year-old kid about public transit, like that was adorable.
Oh.
That's cute.
One year I dressed up as Sarah Brown, who isn't a real person. Like I just made her up. And I think I wore all brown. And
Okay.
I'm so confused by that because I don't know like if my parents asked me like, wait, what are you doing for Halloween? Or if I just like decided it. I remember I just like wore all brown. I had a tight little bun in my hair. I was like, I'm Sarah Brown.
What?
Yeah,
That's
but
funny.
I'm like, what kind of child was I to just make up somebody? I was like, wow,
Well,
really?
we all did that. Like we didn't buy Halloween costumes growing up. They would
Mm-hmm.
just be like, go make something out of what you have. Like one year I was Miss Match, like Mrs. Match, but I was
Oh,
mismatch, so I wore all mismatch stuff.
See,
that's
that's clever though.
cute.
Sarah Brown, like, is probably a real person, and I just dressed
Yeah.
as her. I don't know.
Oh my gosh, that's so funny. Today we are joined for the second time by Melayna
Woo.
Whittington.
She's back.
Yes, I'm back.
She's back and better than ever. Melayna is a PA, physician assistant, and she works in family medicine. If you haven't heard the iron deficiency episode, that was her debut, so go listen to it. But today we are talking about cholesterol, which may not sound like the sexiest,
I
most
know.
interesting topic. However, here's the thing. If you care about your health, if you care about understanding your body, cholesterol is a very important topic because let's say you're like us, you're in your 20s to 30s. It's not something that's really focused on very much, but if you're having issues with your cholesterol unknowingly, you're not getting your labs checked, you're not paying attention to your diet, in 20 years, it could become a really bad issue. So it's important to be proactive, know your labs, know what cholesterol even is. Melayna's going to tell us. And that way we're setting ourselves up for success in our 40s, 50s, 60s, and we're not like, oh, shoot, we have a disease now and we have to deal
Right.
with this. So that's why we're talking about it.
I think that, we're young and you think that's such a later in life problem, but it's just really not. It's something you have to think about now and make sure that it's low now because, you don't get clogged arteries overnight. It takes years and years and years and years. So the decisions you make now on like your exercise and what you're eating really matter for your future risk. So I
Yeah.
think that's why it's important for us to talk about. It's checked every year on your annual physical as an adult, and for good reason. So I just want to emphasize the importance.
Melayna, why don't you just tell us what is cholesterol and why is it important?
Cholesterol and lipids, they're types of fats in your blood. They are helpful for the body to make hormones, make vitamin D, make cell membranes. And however, the thing is when you have too much of them, it can cause atherosclerosis, which is hardening and narrowing of arteries in your bloodstream. And that would cause a heart attack or stroke potentially. So cholesterol and lipids are fats, but there's benefits and risks of cholesterol. It comes from 2 sources. One is your liver. Your liver actually produces cholesterol. And the second is from our diet, mostly with eating animal products.
Yeah, I think it's interesting because the main source of the actual cholesterol that's in the body is resorbed from the cholesterol that we synthesize, like you said, in the liver. So
That we
it's
make.
not, yeah, so it's not actually from what we eat. So I think that's interesting. But there's a lot of factors
Yeah.
that go into like the balance of how much you're synthesizing and how much you're getting rid of all of that. So you mentioned the dangers of having high cholesterol really is the atherosclerosis, which is just plaque buildup. Cholesterol is actually essential. It's good until potentially that happens. Tell us like what actually happens when you have high levels of cholesterol, how it ends up forming a plaque in the arteries.
So your blood has lots of fat, lots of cholesterol. It's floating through the bloodstream. And if you have a lot of it, it'll lodge in the inner lining of the artery and it will embed itself in there. And this causes an inflammatory reaction where the body starts kind of building on itself, kind of thinking that the artery is injured. And then it can form a plaque, like a hardened area that blocks the artery, or a blood clot that also blocks the artery, or could become dislodged and cause a heart attack or stroke. So it starts with kind of like the fat just goes and embeds itself, and then it kind of grows and grows and grows.
Yes, that's helpful. So small LDLs, right, are
Mm-hmm.
the dangerous ones, low density
Right.
lipoproteins that can get in, I guess because they're small, in through the endotheliums, like the lining of the blood vessel, and then form that plaque. So those are the ones that are really the dangerous ones.
Yes, important to note there's different types of cholesterol that do different things in the body. So that can be confusing for people. But yes, like the LDL or similar, smaller, dense lipoproteins are the problem.
Mm-hmm.
To backtrack, LDL is considered lousy cholesterol. It is the type of lipoprotein that takes cholesterol to the arteries to form plaque. And then HDL is considered the happy cholesterol, which takes cholesterol away from the artery and excretes it from the body. So HDL is considered a good thing for it to be high in your blood panel. So you want your LDL to be low, you want your HDL to be high.
So let's talk about different factors that can impact your cholesterol in a good or bad way, starting with diet. How
Mm-hmm.
can diet impact your cholesterol?
Diet is super important for cholesterol. It's actually confusing because some people think that they eat high cholesterol, that they'll have high cholesterol, but it's actually mostly saturated fat. So animal products, things like red meat, butter, fried foods, full fat milk, full fat cheese, those things increase your LDL, which increases your risk of having the high cholesterol and then heart disease later on in life. What's recommended is mostly vegetables, chicken, fish, lean proteins, beans, whole grains, more of a Mediterranean diet. If you think about what people in the Mediterranean eat, it's generally low saturated fat and then high unprocessed foods.
Yes. I think it's important to realize it's not actually the cholesterol that you eat that's
Mm-hmm.
causing it. Like she said, it's more the saturated fat if you do have issues with cholesterol that you could consider limiting. The other interesting thing about diet is high carb, high glycemic
Mm-hmm.
index foods, regardless of if they elevate the LDL, actually have a negative impact on your overall like cardiac risk factor. And I think it's because of the inflammation that it can cause. So like a low fat, high carb diet with excess fructose and glucose, which is sugars from carbs, will negatively impact your cholesterol, which is interesting. And that's from like the insulin resistance that it can cause the small LDL particles to form, which are the dangerous ones that we talked about that actually get into the artery. And then sugar itself increases levels of triglycerides, which are
Mm-hmm.
harmful. And then ApoB, which is a specific type of cholesterol that is very dangerous as well. So carbs and triglycerides have a direct relationship in a negative way. So when you eat the carbs, you get excess sugar, and it's used to build fatty acids, which are then packaged into triglyceride molecules. And then high levels of triglyceride in the blood cause the dangerous, like very low density lipoproteins to form, and then that can further cause plaque. So diet can be a little bit tricky because I think it's the high carb, high
Mm-hmm.
inflammatory diets, but also sometimes for some people the high saturated fat diets. So like Melayna said, like the Mediterranean diet, if you're focused on real food, good plant sources, like lean protein, and then healthy fat, which I think is confusing
Yes.
for people. But, there's a difference in the healthy fats, like let's say fats that lower your inflammation would be like high in omega-3s, right? So extra virgin olive oil and olives, avocados, fish, nuts. Yeah. And then some of the other fats that are pro-inflammatory would be high in omega-6s. Do you want to talk about the other categories that could impact it, like exercise, stress, inflammation?
Yeah. So
Okay.
Regular exercise helps with your cholesterol as well. Specifically helps increase your HDL, which is, again, that good cholesterol. Um, and then genetics has a major effect, which I think is something that people probably don't fully realize. It kind of runs in families. Some people are just more likely to produce more cholesterol from their liver. So, I mean, my husband, Grant, has high cholesterol and he is a sports fanatic and is always running around and exercising, and we eat pretty healthy. So it's just a genetic component sometimes. Other things, you mentioned like the high sugar diet. So if you have diabetes, for example, that automatically increases your risk of having high cholesterol because of the inflammation in the diet. Smoking can as well.
Smoking because the endothelial dysfunction.
Probably
Yeah.
inflammation in the body. Yeah.
Interesting.
Mm-hmm.
Okay. That is helpful. The other topic that I thought was really interesting, and this is actually what got me really fascinated in cholesterol because it happened to me, is how GI or gut inflammation can impact your levels of cholesterol. Because I was always like, my cholesterol is great. I've had it checked at my primary care visits, at my annual physicals. It's always good. Not worried about it. No, like our parents don't have issues with this. But this was fascinating. I developed some GI issues honestly since I had my baby. So I don't know if it was, I had to get a blood transfusion. So I have this theory that, like, I don't know, maybe that triggered some sort of immune response in me. And I've been having some gut issues with like bloating, some nausea, poor motility, stuff like that. And also not reacting well to certain foods. So I got this whole function panel of labs that tested very in depth, like all the different particles of my cholesterol and the different types and all of that. And it was very concerning. Out of nowhere, I had high LDL. My ApoB was kind of high, and my HDL was good, which is good. But anyway, kind of concerning. I was like, huh. So I started looking into the relationship between GI inflammation and cholesterol. And I think it's so fascinating. So these are the notes I took. GI inflammation, both acute and chronic, which could be from a GI infection, like if you get a bug, a systemic viral illness that causes like some GI distress, or chronic GI conditions. So think of somebody with IBS, Crohn's disease, ulcerative colitis, anything that causes just kind of chronic gut issues. That's associated with dyslipidemia, which is just like bad lipid or cholesterol levels because it alters lipid metabolism. So it leads to increased triglycerides, which is not good, decreased HDL, which is not good, and then variable effects on your LDL and sometimes causing it to increase. And then also will increase your total cholesterol. And the reason that it can increase those bad levels is because it's impaired transintestinal cholesterol efflux, which sounds so crazy. But all of that means is that, like, in order to, your body has a system where it will get rid of the cholesterol it doesn't need if everything's healthy. And it does that by, there's these little like channels on the lining of the gut that can accept the cholesterol, and then it goes into your intestines and then you poop it out, any excess cholesterol. So it's very important for those channels to be functioning correctly and for your GI motility to be normal in order to like get rid of the cholesterol. So inflammation impairs that efflux where the cholesterol is leaving through the gut. And so you get more cholesterol in the blood and then less leaving in the poop. And IBD, which is inflammatory bowel disease, so that's Crohn's or ulcerative colitis. Hopefully you guys don't know people with that or don't have that, but if you do, give them a hug because those are really hard conditions to have. Those are associated with an increased risk of high cholesterol and cardiovascular disease because of that. So fascinating because I never knew those were connected and I never really cared about cholesterol. But in case anyone else has like randomly high levels of cholesterol and you've never dealt with it, and you also have gut issues, that could be something that's really fascinating to talk to your provider about. Because if you can control the gut issues and get to the root cause, then your cholesterol will also improve. So fascinating.
My husband said he had elevated cholesterol after he had mono and POTS. So I don't know which one might have caused it, but
Probably
that's
the mono.
interesting. Yeah.
Yep.
Yeah, the physiology of this stuff is crazy.
Yeah.
You can really do a deep dive on cholesterol and how it's affected. Like it's, yeah, so many processes in the body, but
Yes.
very
I know.
interesting.
I was getting Melayna when we were like preparing for this kept being like, let's keep it simple because
I
I
was like,
go
Susie, we could have a 5-hour long podcast if you want.
like I can just go down rabbit trails of being like, oh, so if this happens, what is this and this and this and that? And it's like no one cares because it's like so detailed. So
Well, I think it
Melayna's keeping us on
matters.
track.
No, it's interesting. It's so interesting, but it's complicated
It's too
stuff.
much.
Yeah, it's very complicated.
I think it
Yeah.
matters, but it sounds like you need to know your blood work. You need to know, like, if you're altering your diet, if you're taking supplements, like, make sure you know why. Like, if you don't have a deficiency in these areas, or let's say you are anemic, so you're eating lots of red meat. I don't know. Like, I just feel like you have
Yeah.
to be careful. There's different foods for different deficits. And if you're just seeing these trends and changing your diet because of that, one, you might not need to. It might just be unnecessary. And then also you could be negatively impacting another system of your body without knowing it. So it's like, it is important to know. But when I was looking at some of y'all's notes, I was like, this is not English. Like, this actually doesn't make any sense.
I've polled so many family members and friends and said, do you know why we should have low cholesterol? And everyone's like, no, but I know that it should be low.
Mm-hmm.
That's everyone's answers. And I was shocked by this. I was like, what do you mean? Some people will say, oh, I think it has to do with the heart, but they don't actually know why we're supposed to have low cholesterol. They just know we should. So I think this topic's very important.
Wait,
basically.
And when you say low cholesterol, you're saying low like LDLs, or are you saying?
Yeah, I guess pretty much everything besides HDL should be low.
And do we need, like, do LDLs serve any good purpose? You might have already said that, but like, do we need any?
Yes.
Okay.
Yeah. I mean, it can be quite low. Like cardiologists will say it can, if you've had a heart attack or stroke or something, it can be pushed pretty low and still be safe and healthy, but we do need some of it for the function of our cells in our body.
Okay.
Yeah.
Yeah. It's essential, but you have to keep it in balance for sure.
Yeah.
Cool.
All right. Talk about how we measure cholesterol. Like,
yeah, usually at your annual physical, you get a lipid panel drawn. It's usually done fasting, and normally it will test total cholesterol, LDL, HDL, triglycerides, and then non-HDL, which is every other type of cholesterol besides the HDL. So typically it comes back with a bunch of numbers. It can be very confusing and overwhelming for people because it's hard to figure out how to interpret it. But yeah, it's tested in just a normal serum blood draw. It's really important to know that your blood test doesn't necessarily correlate to your atherosclerosis of your arteries, meaning, again, the clogged arteries. Like, just because you have a normal lipid panel in your blood doesn't mean that you don't have plaque in your arteries, and vice versa. So just because you have high cholesterol doesn't mean you have plaque. So it's kind of an easy, cheap test that we use to determine your risk, but it's not perfect.
So that's the lipid panel. Some people, like if you go see a specialized cardiologist, or if you do like a more in-depth lab panel, you can check your particle size and count numbers, and then you can check your lipoprotein A and lipoprotein B, just in case someone hears that, because it's kind of like hot in like the wellness world right now. So I just wanted to explain it. Lipoproteins are cholesterol containing particles in your blood that transfer fatty acids around. So they basically are like the transporter of cholesterol. So that's what's actually like moving it through the blood and moving it into the arteries, if that's where it goes, moving it to the liver, moving it to the intestines to be excreted. You can measure the type and the size and the density of the actual lipoproteins, which is much more specific for your risk, but it's not commonly done because it's expensive. So like I said, if you have small and numerous LDL particles, that's going to be the most dangerous versus like large fluffy ones. The large fluffy ones don't get clogged in the arteries as much. So just a caveat in case. I think it'd be helpful to talk about the numbers and just talk about what numbers you're concerned about if you see, and then we can go ahead and talk about the management too.
So for LDL, Normal is typically less than 100. If you've had a heart attack, a stroke, a mini stroke, peripheral vascular disease, then you might want your LDL to be less than 70 or less than 55. But for a healthy person, normally less than 100. Above 100, between 100 and about 130, is considered not really increased, maybe less than optimal, but not increased. And I think that confuses people because you might see your LDLs 110 or 115 and think that's really high, but it's not. What we consider high is usually above 160 for an LDL specifically, and above 190 is very high. So that's kind of the range. And LDL is definitely one that we focus on the most in a standard lipid panel because that's the one that, again, can lead to the clogged arteries. So kind of focusing on that one. For triglycerides, triglycerides are a little bit of a wider range. So you want your triglycerides to be less than 150. From 150 to like 499, it's definitely increased. But when it's above 500, you start to think that that's like very high, where you could actually get pancreatitis, like an emergent condition from having really high triglycerides. And then for HDL, for women, you want the HDL to be greater than 50. And for males, you want the HDL to be greater than 40 generally. And this is interesting because I didn't know why there was this gender difference, but it's because women have estrogen and estrogen causes us to have naturally higher HDL, which is kind of cool. Yeah.
We're so happy.
Yeah. Except when we go through menopause and then it decreases and then our
lovely.
heart disease risk goes up. Yeah. I think those are all the numbers. What did I miss?
I think you got it all. Yeah.
Yeah. Non-HDL, you want it to be less than 130. And then I guess for triglycerides, I will say, I forgot to mention, like 150 to 199 is borderline. So again, if you see it slightly increased on your panel, it's not considered high. It's in this kind of gray area.
This is, again, a little caveat, but this isn't necessarily related to your plaque burden or like plaque risk. But I think this is interesting for metabolic health. If you get back your lipid panel and you want to see, it's kind of like a little trick to see like how metabolically healthy am I? And it correlates with like your fasting insulin and your diabetes risk. If you take the triglyceride number and you divide it by the HDL, you want it to be less than 1.5. So let's say, for example, like 100 is your triglyceride, 70 is your HDL. Like that's probably going to give you a pretty good ratio. So I thought that was interesting. It's like kind of fun to dissect your labs a little bit and be like, am I metabolically healthy? So if you want to do
And
that.
how does that relate to metabolism? Can you re-explain that?
It's just a marker. It's just how well your metabolism is functioning. Like, can you tolerate sugars well? And are you processing sugars well? Basically, if that marker is less than 1.5, as well as, let's say, your fasting glucose is low, your fasting insulin is low, you're less likely to develop diabetes or issues with that, like high blood pressure and those things.
Okay.
ApoB and the lipoprotein little a tests are a great additional test to the lipid panel, like you mentioned, specifically for people who have this like unclear risk category. Maybe like your triglycerides are a little bit high, but your LDL is normal, or you have a strong family history, but your lipid panel's normal, or maybe you have an unexplained cardiac event and everything's always been normal for you. So I think those two tests are really great add-ons when you just want more information because your actual lipid panel might be a gray area.
You did mention that the lipid panel isn't necessarily like it's a cheap screening test, basically. If you're concerned about someone's actual plaque burden, what else can be looked at?
One test that I think is really interesting, and Cruzy, I'm sure you also think it's super interesting, is the coronary artery calcium score. It's a CT scan of your coronary arteries that looks at how much plaque burden that you have there. It's actually pretty cheap if you don't have insurance or you want to pay out of pocket for it. I think it's only a few $100s.
Okay.
It's like everything in medicine. There's like, it's not a perfect test. It only looks at calcified plaque. That's all that the CT scan can see. But it's a really good extra test to see, okay, I know what my blood says my fat is. Now let me look at my coronary arteries and see if I have any plaque actually in my heart. So,
Okay, cool. Let's talk about management. We talked about diet. If you are concerned about your cholesterol, if you have a family history, if your levels are borderline high, following a Mediterranean diet is recommended by the guidelines. How about like supplements and medications? When do you think about that?
so you think about supplements or medications in specific scenarios. One, of course, if you're somebody who's ever had any evidence of atherosclerotic cardiovascular disease, again, heart attack, stroke, mini stroke, peripheral vascular disease, then you're going to want to be on a medication. That's what's recommended. If your LDL is greater than 190, that's considered very high. So then you're in a higher risk category. So a medication would be recommended in that situation. If you're between the ages of 40 and 75 and you have diabetes, normally your LDL cholesterol is much greater than 70. So a medication would be recommended then. And then we use these other risk scores to plug in information about patients, different risk factors, like do they smoke? Do they have high blood pressure? And their age. And that determines their 10-year or 30-year risk of having a heart attack or stroke. And based on that number that you get, you can kind of categorize the risk and figure out, okay, having a conversation with the patient, what do you think we should do at this point? The calculator says you're high risk. Do you want to start a medication? So I think those are the big scenarios that you would kind of jump to a medication. And most other scenarios, you would definitely start with the lifestyle changes first.
And what are the main medications that patients are on?
The biggest one are the statins. The statins block your liver from making more cholesterol. It's like atorvastatin, simvastatin, rosuvastatin. Those are the most common, especially for anyone that's had anything happen to them. And then another really common one's called ezetimibe. It stops your body from absorbing as much cholesterol in the gut. So those are the two I probably see the most. And as far as supplements go, I see a lot of people on fish oil. You have to take a lot of fish oil. You have to take 4 grams a day in order for it to be effective, which is usually like 2 capsules in the morning, 2 capsules at night. But fish oil or the prescription fish oil is called icosapent ethyl. If I'm pronouncing that right, I don't know.
Sounds right. Yeah.
Icosapent ethyl, but yeah.
Okay.
So.
Awesome. And then I think some people take plant sterols, like phytosterols you might see to help. It helps with your gut. So it promotes that transintestinal cholesterol efflux, like putting it into the intestines. And then it also can reduce the cholesterol absorption and then reduce inflammation. So
I think it'd be helpful just to summarize, because I've heard there's good cholesterol and there's bad cholesterol, but that's not totally true. It's just that you want lower levels of LDL, higher levels of HDL. Are there any kinds that are just truly bad cholesterol that you don't want?
no, I think it's what you're saying. It's more like having the balance, because you definitely don't want a high number of small LDL particles floating around in the blood. But again, that would only be found in a more in-depth lipid panel where it's looking at the actual particle size and number and the LPA and the ApoB. Most people wouldn't be getting that and likely don't need it until like maybe a one-time screening later in life. But yeah, I think it's more about the balance. All of those types of cholesterols are created in the body because they're serving a purpose, but you don't want them out of range. And the good and bad cholesterol is like not, it's kind of an outdated term.
Yeah. It's just a really easy way to simplify it. So if you want a really easy way to simplify it, I would say HDL, you want that one high, and pretty much everything else you want low.
Yeah.
But they're all necessary. Another thing I think I want to mention is that having high cholesterol is asymptomatic. So you're not going to feel different if your cholesterol is really high unless the high cholesterol is causing something else. Again, causing a heart condition or it's causing pancreatitis, unless it's very, very, very high, you're not going to notice feeling different. at all.
Yep. And that's again why preventative medicine, getting your labs, taking care of yourself with good diet, stress reduction, limiting alcohol, don't smoke, like all of those things are really important because you can't feel it. Like it's not like you get sick when your cholesterol's high and you're like, oh, my cholesterol's high. So yeah, that's important.
And cardiovascular disease is like the #1 killer of people in the world and of women. So it's very, very important, very prevalent. And
I wonder, we just need to talk way more about like nutrition, specifically for women and specifically in different stages. What? Phases? In different phases of life, like postmenopause. Like it might be beneficial to change your diet or to change something about your life specific to cholesterol. Like that's just, it's unfortunate, but that's good to know.
yeah, that our protective mechanisms go away post-menopause.
Yeah, that's so interesting. Like why? Because we're done having children. It's like, all right, see ya.
We don't need you anymore.
We don't need you.
You served your
You're
purpose.
useless. Oh gosh.
No, but yeah, Eden, I agree.
Horrible.
We need a dietitian to talk about all that stuff, honestly.
Yeah.
So
Yeah.
we'll
Are
find
there
her.
any contraindications for taking medication?
The biggest one is liver disease.
Mm.
Since it's targeting, a lot of the medications target the liver because of the liver producing cholesterol. So if you already have an inflamed liver or a liver problem, then you probably shouldn't be on a cholesterol medication that targets the liver.
Okay.
So that's the biggest one. But for the most part, they're pretty well tolerated by people. They're very common medications. So
The only other one I hear about sometimes is like a statin-induced myalgia or like muscle necrosis and damage. It's very rare, but
yeah.
well, I think you crushed it. I think that was everything we needed.
Yeah,
I feel
think
so
it's
informed. I really thought cholesterol was only for like 80-year-olds that had a history of like heart disease. So this matters for all of us.
It really does. And I actually was just on a walk and with one of my friends, and I asked him, I was like, so what do you know? Like, do you know why cholesterol needs to be low? He was like, no, absolutely not. 0% chance. I just know it should be low. I'm like, this is just so crazy. I'm like,
Yeah.
I'm like, all these college educated people and nobody
We don't know anything
knows-
about our bodies.
Nobody knows why. When I tell patients why, they're so much more eager to make the lifestyle changes when they know why, instead of me just saying, you know, your cholesterol should be lower. If I say to prevent XYZ, they're like, oh my God, I'm going to the grocery store and I'm making changes. So it's, you know, because like it makes so much more sense.
It's easy to not care when you're young and healthy, but again, it's like a silent killer, and it's like you have to think about it 20, 30 years in advance. So, yeah. Well, thank you. Always appreciate everything you share.
So much fun, you guys.
Yes. And I'm sure there's another one in the future, so she'll be back. Yeah.
I'll be back for more.
Okay, bye.
Bye.
Disclaimer, this is not medical advice. This is just for educational entertainment purposes. Always talk to your provider if you have questions about your health.